Welcome to this module on the revised Mild Traumatic Brain Injury Program of Care. My name is Dr. Aaron Thompson, Chief Medical Officer of the WSIB, and it is my pleasure to provide this overview of the program for you. The objectives of this module are to describe the elements of the Mild Traumatic Brain Injury Program of Care, or mTBI POC, and who delivers the program. To explain the key updates in the new mTBI POC, including admission, structure, and delivery of the program, and to describe the mTBI POC reporting and communication requirements for providers. What is the Mild Traumatic Brain Injury Program of Care? The mTBI POC is a community-based healthcare program for patients who have been diagnosed with mTBI. The program elements are based on current evidence-informed guidelines and were developed collaboratively with community health care provider input. The program is designed to provide early care to help non-complex mTBI patients recover and return to work. The program also helps to identify people who have complex injuries or who are not recovering as expected, and to appropriately triage them to more specialized WSIB program services. Who can deliver the Mild Traumatic Brain Injury Program of Care? The program is designed to be provided by regulated health professionals who have the scope of practice to deliver the program based on their skills, experience, and knowledge of mTBI. The mTBI POC can be delivered by a sole provider or an interdisciplinary team. Please note, when delivered by an interdisciplinary team, only one healthcare professional or clinic may submit bills for the treatment under one provider number, and information is consolidated in one report. Therefore, coordination of care must be done at the provider level, but ultimately result in a single billing and single reporting mechanism. How does the new mTBI POC differ from the prior program? The new program differs in important ways in both the admission criteria and the program structure. The admission criteria for the mTBI POC requires that the injured person have an allowed WSIB claim. They need to have been diagnosed with an mTBI by a physician or nurse case practitioner. They must have negative findings on all neuroimaging studies, if completed. They must be 18 years of age or older, and they must be within 3 months of their date of injury. In some instances, an injured person may not meet these criteria. In those circumstances, if you still feel that the injured person would benefit from the program of care, you should contact the WSIB clinical expert. The WSIB clinical expert will help determine if the program of care is appropriate and may suggest a referral for specialized services to further assess the injured person. Let's go over the program structure. The revised mTBI POC is an 8-week assessment and treatment program consisting of 2 blocks of care. In Block 1, there is the initial assessment and report. Block 1 is the longest block, requiring a minimum of 5 visits. A mandatory call to the WSIB clinical expert must take place at the end of Block 1 if the injured person is not progressing as expected. Also, at the end of Block 1, a midpoint report needs to be submitted. If the patient requires a second block of care, this can be provided. Block 2 is a minimum of 4 visits. A mandatory call to the WSIB clinical expert is to take place 1 week prior to the end of Block 2 if the injured person is not expected to make a full recovery and/or return to work. A care and outcome summary is required at the end of Block 2. What happens if an injured person ends the POC early? If the injured person recovers and returns to work before completing the full mTBI POC block of care, therefore resulting in fewer than the minimum number of visits, the provider will still be paid half of the block fee. The provider must submit the care and outcome summary when the injured person is discharged or self-discharges. What measures and reports are required in the mTBI POC? The initial assessment is completed in Block 1. The required outcome measures are the Patient-Specific Functional Scale, or PSFS, and the Rivermead Post-Concussion Symptoms Questionnaire. Providers may use other outcome measures if they're deemed to be appropriate. However, the Patient-Specific Functional Scale and Rivermead Post-Concussion Symptom Questionnaires are required parts of the program. What are the main components of the mTBI POC? An essential component of the mTBI POC is education. Education should focus its attention on common symptoms to be expected, general usual recovery times for mTBI, and reassurance along with advice on how to manage symptoms in order to maximize function. Injured persons must also be encouraged and guided in gradual integration of activity. This is an essential component of care and consistent with current guidelines for the management of concussion. Progressive exercise therapy is also an evidence-based intervention for management of mTBI concussion. This should be done in a prescriptive manner following recognized protocols. An example is the Buffalo Concussion Treadmill Test. Information on progressive exercise therapy and the Buffalo Concussion Treadmill Test can be found at the WSIB webpage on the mTBI POC. Manual therapy, including treatment of the neck, are also included in the program of care. This means that injured people with cervicogenic symptoms and requirements for manual therapy need not also be enrolled in the MSK POC. Are there other components that can be delivered if indicated? An optional intervention is vestibular rehabilitation. Providers must be able to evaluate the need for vestibular therapy, though they do not necessarily have to be able to provide this treatment themselves. When vestibular therapy is required based on objective findings, if it is within the provider's scope of practice, either as a sole provider or within an interdisciplinary team, to deliver vestibular therapy, they can include it in the block of care, and an enhanced block fee will be paid. If it is not within the provider's scope of practice to deliver the vestibular therapy themselves, the provider should contact the WSIB clinical expert. The clinical expert can assist with options to facilitate care. Please note the providers who are able to deliver vestibular rehabilitation are indicated in the mTBI POC directory on the WSIB website. What should I do if an injured person requires an intervention not included in the mTBI POC? The mTBI POC is intended to provide services that most mTBI patients may require. It does not therefore include the whole spectrum of services that may be indicated in select cases with persistent symptoms. If an injured person has persistent symptoms after primary symptoms have been adequately treated in the mTBI POC and may benefit from other treatments such as cognitive rehabilitation or vision therapy, please call the nurse consultant who can facilitate referral for specialized interdisciplinary assessment and services. If the injured person has significant mental health symptoms, which have not responded to education, reassurance, and symptom management, please call the WSIB nurse consultant, who may make referral to mental health services. How is return to work incorporated into the mTBI POC? Staying at or promptly returning to some form of work enhances recovery and is part of the rehabilitation process. This holds true for mTBI, similar to other injuries. Full recovery is not a requirement for return to work, and in many cases, a return to work will use a phased approach and occur concurrently with the treatment being provided. mTBI POC providers should discuss return to work planning with their patients at the start and throughout the program. To facilitate early and safe return to work, providers should clearly and concisely document abilities, restrictions, and limitations. Doing so will help the employer provide appropriate accommodations so the injured person can remain actively employed in some capacity. Can treatment be extended if recovery goals are not met by the end of Block 2? In select cases, an additional 4-week supplementary block may be provided with WSIB approval. A supplementary block may occur under the following circumstances. If the mTBI POC provider identifies a need for additional treatment, for example, the injured person has not fully recovered and is performing modified duties with full recovery and return to work anticipated with support of additional 4 weeks of treatment, then a request can be made to the WSIB clinical expert for approval. If an injured person does not progress as expected in the first 2 blocks of the mTBI POC, prompting assessment by occupational health program or neurology specialty program, recommendations may then be made by one of those programs for further treatment in the mTBI POC. The provider may also submit a final report when the approved supplementary block is completed. This is actually a mandatory component of the supplementary block. What are the communication requirements in the mTBI POC? The key communication points in reporting during the mTBI POC are the initial assessment report, which is due 2 business days after completion of the initial assessment. The midpoint report, which is due 2 business days after last treatment session in Block 1, and the care and outcomes summary, which is due 2 business days after discharge from the program. Please note if there's less than detectable change on the PSFS and/or the provider recommends vestibular rehabilitation, they should call the WSIB clinical expert. Please also note that a call to the WSIB clinical expert is required 1 week prior to program completion if the injured person is not expected to meet their recovery and return to work goals. Do I need to register to deliver the mTBI POC? Yes, you will need to complete the online registration form to deliver the updated mTBI POC. This is even if you were registered to deliver the previous mTBI POC. By registering, the provider will be listed on the new mTBI POC directory, which has updated information for injured people seeking care. You will need a WSIB provider ID to be able to register. You can find all necessary information on the WSIB website at wsib.ca. I am treating someone under the prior mTBI POC. What should I do? Injured people currently receiving treatment in the previous mTBI POC should finish treatment under the POC. Beginning October 5th, 2020, you can deliver the new mTBI POC. There will be a transition period until October 30th to provide you with the opportunity to review materials and complete the mandatory registration process. Effective November 2nd, 2020, all injured people starting the mTBI POC will be seen in the new program. There are additional resources available to support you in the provision of services for the mTBI POC. The primary reference to guide evidence-based care in the mTBI POC is the Ontario Neurotrauma Foundation Guideline for Concussion mTBI. This is freely available on the web and can be found by Google search or on the WSIB website. The Center for Effective Practice has a quick reference which helps to operationalize the ONF guidelines and other evidence-based clinical resources. This tool effectively summarizes most of the main points of the Ontario Neurotrauma Foundation guideline, and it is a very useful quick reference. Finally, the WSIB mTBI POC supporting materials are available on the WSIB website, and these include the quick reference guide, a fee schedule, the billing tip sheet, questions and answers, forms, registration information, and the provider directory. Thank you very much for your careful attention to this module, and I hope it has been a useful overview of the new program.